These are some indicators that you may be at risk for committing suicide. Individuals at acute risk for suicidal behavior most often talk or write about death, dying, or suicide. They will threaten or talk about hurting or killing him or herself. They will look for ways to commit suicide by seeking access to firearms, available pills, or other means. They may also increase the use of alcohol or drugs, act anxious or agitated, behave recklessly, feel withdrawn or isolated, and display extreme mood swings. Additional signs include a preoccupation with death, loss of interest in things you care about, visiting or calling people to say goodbye, making arrangements, and giving things away, such as prized possessions. Suicide is the second leading cause of death among 25 to 34-year-olds and 15 to 24-year-olds in the United States. In fact, each year, there are far more suicides than homicides. Today, the suicide rate is 12.6 suicide deaths per 100,000 Americans, the highest it's been in more than 25 years. Teenage suicide in particular is a serious and increasing problem. The teenage years can be emotionally difficult and stressful. Teenagers face pressures to succeed and fit in. They may struggle with self-esteem issues, self-doubt, and feelings of alienation. For some, this leads to suicide. Common misperceptions include the following. Anyone who tries to kill him or herself must be crazy. This is false. They may be upset, in grief, or depressed. Most suicidal individuals are not psychotic or insane. Extreme distress and emotional pain are always signs of mental illness, but are not necessarily signs of psychosis. If a person is determined to kill him or herself, nothing is going to stop him or her. This is false. Even the most severely depressed person has mixed feelings about death, and most hesitate until the very last moment between wanting to live and wanting to end their pain. People who commit suicide are people who were unwilling to seek help. This is false. Studies of adult suicide victims reveal that over half had sought medical help within 6 months of their deaths, and a majority had seen a medical professional within 1 month of their death. Talking about suicide may give someone the idea. This is false. You don't give a suicidal person ideas by talking about suicide. The opposite is true. Bringing up the subject of suicide and talking about it openly is one of the most helpful things you can do. What to do? For you, if you are the one feeling hopeless and thinking about suicide, please remember that you are not alone. There are people who care about you. Reach out to those you trust and professionals, and seek help to work through your problems. There are always solutions to problems. Suicide is not one of them. Sometimes, you just don't see the problems clearly by yourself. Developing a positive outlook is extremely helpful. For someone else, if you know someone who is thinking about suicide, you can try the following. Begin a dialogue by asking questions. Your willingness to talk about the problem in a non-judgmental, non-confrontational way can be the help a person needs to seeking professional help. A suicidal person should see a doctor or mental health professional immediately. Calling 911 or going to a hospital emergency room are also good options to prevent a tragic suicide attempt or death. Calling the National Lifeline at 1-800-273-TALK is also a resource for you or the person you care about for help. Always take thoughts of or plans for suicide seriously. Never keep a plan for suicide a secret. Do not worry about risking a friendship if you genuinely feel that a life is in danger. You have greater things to worry about. Someone's life might be in danger. It is better to lose a relationship from violating a confidence than it is to go to a funeral. Most of the time, they will come back and thank you for saving their lives. Do not try to minimize problems or shame a person into changing his or her mind. Trying to convince a person suffering from a mental illness that it's not that bad, or that they have everything to live for, may only increase their feelings of guilt and hopelessness. Reassure them that help is available, that what they are experiencing is treatable, and that suicidal feelings are temporary. If you feel the person isn't in immediate danger, acknowledge the pain is legitimate and offer to work together to get help. Make sure you follow through. Help find a doctor or a mental health professional. Participate in making the first phone call, or go along to the first appointment. If you're in a position to help, don't assume that your persistence is unwanted or intrusive. Risking your feelings to help save a life is a risk worth taking.